We want to make sure that patients know that they can get healthcare no matter where they live. You live deep in the south side of San Antonio, that doesn't mean you shouldn't get quality healthcare. You should still be able to get quality healthcare, and we found that they needed us in their neighborhoods. And that's how we have many clinics are in the south side of San Antonio. These are working families who have regular full-time jobs but don't make enough money to afford private health insurance. Maybe their employers don't offer them health insurance, they're self-employed, so they struggle getting access to care. And it's not only by being available for them in their own neighborhood, but also financially available to them. So we are offering rates that families can afford if they do not have health insurance. If they do not have a way to pay for their health care, they are charged on a sliding fee scale based on their income and family size, which makes it very convenient for the family to make sure that they are accessing the care that they need without feeling they're breaking the bank or having to make a decision, do I put food on the table or do I go to my medical doctor? They can afford to do both. As we serve the Hispanic community, one of the issues that we want to make sure that we're addressing is cultural competence. So the majority of our staff that we hire are bilingual. So they speak Spanish, they speak English, and they're able to help our community. We print a lot of materials that are easy to read and understand. We have patients that speak a variety of languages. So we have language interpreters that we can get on the phone and really interpret for the patient and for the provider as to what is happening with the patient. CentroMed is honored to be the agency that provides all of the healthcare for the homeless in San Antonio. We serve 6 homeless shelters, but providing the medical primary healthcare services that our homeless community needs. And we couldn't do that without the support of Methodist Healthcare Ministries. Well, we're really honored to work with Methodist Healthcare Ministries. They've been a great partner of CentroMed for over 20 years. Without the support of Methodist Healthcare Ministries, I'm not sure that many of our buildings would be in existence today. We're fortunate to be standing in the grounds of CentroMed Southside Medical, which was funded through financial support from Methodist Healthcare Ministries.
So when we started looking into different areas of San Antonio that are right now medically underserved, we came across the Indian Creek community with the help of some of our local government leaders. And within that zip code of 78242, there was not a single primary care provider. So when we saw that, we decided we really needed to try to raise the funds to build an adequate facility to fit the needs of the community. And we're fortunate to have the partnership with Methodist Healthcare Ministries, who came on board early on in support of the growth of our medical clinic there that encompasses a primary care clinic on one side and an adjacent wellness center. What we envisioned at the wellness center at Indian Creek is a comprehensive services of nutrition, educational group classes, as well as your typical gym equipment, an outdoor basketball court, and hopefully an indoor swimming pool.
In addition to support to build facilities and grow our services, we're fortunate that Methodist Healthcare Ministries has been a partner in providing grants and programs where patients can get the health care that they need at a very low cost. With their support, patients are able to get the primary health care services that they need on a regular basis, not only for them, but their children. In many situations we've seen where patients have had their babies and now their little babies are growing up and becoming adults and having their own children. So one of the things we see is our community continues to grow. We see many families who still need healthcare. They still need access to healthcare. And with the support of Methodist Healthcare Ministries, we're able to continue to provide those services, continue to grow and serve other communities, continue to expand the hours of operation that we serve, continuing to serve many families who maybe don't know where to go to receive healthcare services. But we can't do this alone. We need the support of Methodist Healthcare Ministries, and we know that working together, we can keep our community healthy.